Welcome to this video on counseling. Counseling is a professional relationship that empowers individuals, families, and groups to accomplish mental health, wellness, education, and career goals. The NHS defines counseling as a, quote, talking therapy that involves a trained therapist listening to you and helping you find ways to deal with emotional issues. Counseling is a face-to-face communication aimed at helping a person make decisions, solve problems, and act on them. It is a helping process focused on problem solving and can be done with individuals, groups, or couples. Counseling is specific to each client's needs, interactive, collaborative, and goal-directed. It is acceptable within social and cultural contexts and aims to bring about change in attitude. Counseling as a profession involves setting aside dedicated time to explore a client's difficulties, helping them see their situation from a different viewpoint to facilitate change, and building a relationship based on trust and confidentiality. It is important to note that the counseling process should not include providing advice, being judgmental, pushing the counselor's values, encouraging the client to behave as the counselor would, or involving emotional attachment. One of the key goals of counseling is facilitating behavior change, which enables the client to be more productive. According to Rogers, behavior change is a necessary result of the counseling process. Another goal is improving relationships. Counselors strive to help clients develop more effective interpersonal relationships, which improves the quality of their lives. Counseling also aims to facilitate a client's potential by helping individuals cope with new situations and challenges encountered during the process of growing up. Promoting decision-making is a central goal. Counseling enables individuals to make critical decisions without outside influence, clarifying emotional concerns that may interfere with their choices. Counseling seeks to enhance potential and enrich self-development. This includes helping individuals cope with challenges and maximizing their freedom by giving them control over their environment. Counselors can also assist in overcoming issues such as sexual dysfunction, drug addiction, gambling, and obesity, as well as addressing anxiety, shyness, and depression. A major goal of counseling is the achievement of positive mental health. It goes beyond resolving problems to build resources and strengths, promoting positive feelings, mental health, and well-being. There are three main types of counseling: psychodynamic or psychoanalytical counseling, behavioral counseling, and humanistic counseling. Psychodynamic counseling explores the client's mind, including subconscious and unconscious elements like past traumas, to understand present-day problems. The aim is mental balance and recognizing hidden motivations. Humanistic counseling assumes every individual is unique and capable of growth. It focuses on how a patient experiences life events, helping them become mindful of their responses and find their own solutions. Behavioral counseling addresses unwanted behaviors, believing they are determined by environment. It focuses on examining past learning, with the goal of unlearning problematic behaviors and achieving change. In addition to the three main types, there are other important counseling types. Cognitive counseling aims to align a patient's thinking with reality, as misalignment can cause difficulties. Counselors challenge thinking patterns to help clients discover accurate solutions. Constructionist counseling is based on the idea that knowledge is a constructed understanding of events. Counselors help clients change problematic constructions of themselves, relationships, and the world. Systemic counseling looks at difficulties in relation to a person's role in social systems, such as family networks, assuming that thinking, feeling, and behavior are influenced by societal pressures. The counseling process is a planned, structured dialogue. A qualified counselor helps the client identify the source of concerns, and, together, they find approaches to deal with the problems faced. Hackney and Cormier propose a 5-stage model that defines the counseling process through which both the counselor and client move. Stage 1, relationship building, focuses on the counselor engaging with the client to explore issues. Good listening skills are essential to establish a strong foundation for future dialogue. Stage 2, problem assessment, involves the counselor listening carefully and drawing out detailed information about the client's situation, triggers, and contributing factors. Stage 3 is goal setting. Effective counseling requires setting appropriate and realistic goals, developed collaboratively with the client, who commits to steps leading to a particular outcome. Stage 4 is counseling intervention, which varies based on the counselor's theories and the client's situation. Interventions could be behavioral or person-centered, for example. Stage 5 includes evaluation, termination, and referral. Successfully ending the therapeutic relationship is crucial, whether planned or occurring without prior consideration. For counseling to be successful, the client must commit to 4 key steps: willingness, motivation, commitment, and faith. Willingness involves recognizing the need for change and seeking help, often requiring overcoming anxiety to move out of one's comfort zone. Motivation is essential for sustaining the effort to make changes. Without continued motivation, the counseling process may falter when the real work begins. Commitment means maintaining patience and persisting with the process. Change won't happen without the client's continued dedication and resolve. Finally, faith, belief in oneself, the counselor, and the process is necessary for counseling to succeed. There are also key steps that the counselor must follow to ensure an effective process. Unconditional positive regard is a core step, where the therapist accepts and treats the client with dignity through non-judgmental behavior. Empathy requires the counselor to show genuine understanding of the client's perspective, even if they personally disagree with the client. Congruence means the counselor's words, feelings, and actions are consistent, ensuring authenticity in the therapeutic relationship. Basic principles of counseling include acceptance, communication, empathy, non-judgment, confidentiality, individuality, and non-emotional involvement. Several well-performed steps help the counselor engage with the client and ensure they listen openly, without judgment or expectation, to build and maintain the relationship. These steps include introducing themselves clearly, inviting the client to sit, addressing them by their comfortable name, and engaging in relaxed conversation to reduce anxiety. Pay attention to nonverbal communication to identify the client's emotional state. Use open questions to invite the client to explain their reason for coming to counseling, allowing them time to answer fully. Good communication is vital to all stages of counseling. Key skills should include active listening techniques, clarification, reflection, and effective questioning. To build rapport, counselors must show empathy, see things from the client's perspective, have a genuine interest in their well-being, and use self-reflection to empathize with others. Counselors should show accessibility and authenticity, be flexible in their views on differing values and multicultural issues, maintain a sense of humor, and be resilient. Thank you for watching this video on counseling.